I'm doing the FaceTite because I'm not ready for a facelift. The FaceTite will give me generally a 70% result compared to a facelift. So it's a procedure that's an outpatient procedure that I'm just opting for. I think it's going to give me the perfect result that I'm looking for.
In the first step of this procedure, I inject a combination of numbing medication and epinephrine. The epinephrine really allows the blood vessels to squeeze tight so you don't bleed, and the numbing medication makes the entire procedure very well tolerated. The second step of the procedure, I perform body tight. I put this very thin, fine cannula under the skin, and I set certain parameters on this complex computer. The parameters really allow this device to shut off when I hit a certain internal and external temperature. This allows me to really fine-tune the temperature of the deep dermal tissues so I can create a burn inside without injuring the skin on the outside. Liposculpture not only allows me to better define your jawline directly, but also to eliminate jowls. Finally, it's important because it allows me to take out all these hot oils that can lead to cysts if I don't. After the FaceTite part of the procedure is completed, I close all the tiny stab wounds with 6/0 Prolene stitches. These are what I use in microsurgery. In the first step of the procedure, I harvest the fat and I allow it to sit for a while. By letting it sit, all the fluid within the fat goes to the bottom. I can then squeeze that fluid out and I have pure fat left in the syringe. This fat is then transferred to the Tulip nanotransfer system. I use a larger cannula to pass the fat back and forth through a device that actually emulsifies it. I pass it through a smaller device that emulsifies it further, and then I pass it through a fine filter that protects the cells but really allows me to break the cells down onto a cellular basis. Through this fine fluid, I can inject it into 1 cc syringes through a needle like I'm using any filler. Therefore, I'm using your own fat as a filler. This is a permanent solution for the fat that takes. Then using a needle as an entry site, I actually create very, very careful injection patterns for this fat. Because the fat is so easy to use, I can finely detail where I want to inject it and fill the hands up. I try very hard not to overfill the hands because that's not a good look either. But with a very artistic eye, I believe that I'm performing an ideal refinement of the hands without making it look fake. I use about 9 cc's of fat in this case per hand. The entire operation, including the face and the hands, took a total of 2.5 hours. A lot of that time was really setting up the room and making sure the patient didn't feel anything.